So just giving it another moment or two for anybody else that's going to be joining. And also it's an opportunity to like, share, follow, subscribe if you're watching on YouTube. And we will be getting ready to begin shortly. I'll go ahead and get the topic up over here on Facebook, which is how to improve rheumatoid arthritis symptoms. So anybody that you know that may be interested in our topic, anybody that may have rheumatoid arthritis, or really any woman that is between the ages of 30 and 60, this is appropriate for. Okay? So this is a great time. If you wanted to invite anyone, go ahead and do so. And we are going to get ready to get started. Just a moment. All right, so we're going to get ready to get going. For those of you that may not be familiar with me, I am Dr. Felicia, physiotherapist and certified health coach, and I help genuine open women create true freedom in their lives through better eating and movement habits so that they can enjoy fuller lives and be around longer for their families. All right. I have been a registered physiotherapist here in the Bahamas for 9 years, running a private practice located on Mackey Street in the Mackey Street Plaza for 5 years now. Okay, going on 6. And let's see, over the years, I have helped hundreds of patients reach their physiotherapy goals or physical therapy goals, depending on where you're located in the world. And also, I hope to help thousands more over my career. As a certified health coach, I now seek to help more women that are looking to improve their lifestyle. So make healthy lifestyle changes so that they can feel better, have more energy, live longer, run around with their kids, all of those good things, right? And live a life that is more so not encumbered by lifestyle diseases, diabetes, hypertension, even things like cancer. Okay, so these are the things that we want to prevent as much as possible. Arthritis, like we're talking about tonight, we want to hold these things at bay. All right. We want to age. Well, we don't want to age. We want to age gracefully. We have to age. But it's just how are we going to do it, right? We want to look great, feel great, and be great. All right. So let's see. I do hold several certifications. I am a certified lymphedema therapist and also a certified health coach, as I mentioned. Let's see. And a certified kinesiotaping practitioner. Okay. Working on quite a few things right now, more things in the works. So I'll have so much more to tell you all about. Continue to monitor the stories. Let me know if you've been liking the stories lately. And I will make sure that I give you more of what you like. Be sure that if you like something, you let me know by hitting like or by commenting so that I know to give you more of that. Okay. And stay tuned to the stories for more things like questions and polls that will be coming your way. All right, so this evening's topic, once again, how to improve rheumatoid arthritis symptoms. It's important to know that any information that I share with you this evening in the broadcast is not to be taken as medical advice. Nothing is going to be personalized to anyone. I don't know the specifics of anybody's case. Please do always consult your primary care physician or make sure that you're under the care of a licensed healthcare provider before making any changes to your diet or exercise regimen. Okay? So this is just general information tonight. So let's start with a few quick stats. 1.5 million Americans have rheumatoid arthritis. And out of every 100,000 people, 71 are diagnosed annually with RA. You're going to hear me referring to rheumatoid arthritis as RA going forward in this discussion. And it is a discussion. I like it when it's lively. Feel free to chat with me in the comments, okay? All right, good evening to you over here in Facebook land. All right, so let's see. Rheumatoid arthritis shows up between the ages of 30 and 60 in women, a little bit older for men. Okay, so again, it's us ladies. I must say that something that's been quite surprising to me as I kind of move through life is how soon things start to change. Your body starts to change, the status of your health can start to change. Um, Out of curiosity, what age do y'all consider? Because it fluctuates. It's kind of, I think it's like relative. How old is old? So drop me what age you all think is old in the comments. I feel as though the older that you get, your definition of old actually changes. So out of curiosity, drop it for me in the comments. But I will say that in my personal experience, I don't know if I was prepared for hitting my 30s and then starting to see different changes even in my skin and things like that. I was surprised, and if I had known, I would have appreciated my teenage years and my 20s so much more. I took it for granted how long that period would last, just how much energy you would have had and things like that. I guess you don't have anything to compare it to until you get older. Very interesting. Let's see. Over here in Facebook, someone says that 80, they consider 80 to be old. 80 is a nice ripe age. 80 is ripe. I could agree with that for sure. Which I think is but when you consider 80 as old, right? Overheard someone saying the other day that 40 was middle age. And I was like, wait, whoa, what? Middle age. Hold on. But if you think about it, if 80 is older, if a person is going to live to be 80, then 40 is middle aged. So very, very interesting. Like it's all about like perspective. Very interesting. So I just wanted to give you that. Thanks for sharing. Okay, so the lifetime risk for women in the US to develop rheumatoid arthritis is 3.6%. For men, it's just 1.7%. Now, you all know that as we have our discussions over the weeks and months, the last several weeks and months, it often tends to be the women. Let's see, Instagram, are we back? I think we had a quick break in transmission there. Let me know if we're back. Okay, so it tends to be women, as I was saying, that usually are the ones that we tend to always be the ones that are going to have, like, we get the shorter end of the stick when they compare it to our male counterparts. A lot of the risk factors for a lot of these disorders, diseases, conditions that we talk about on a weekly basis here every Thursday at 7 p.m. on this channel, it tends to be that women have a higher likelihood, or the risk factor is being female, for getting these conditions, disorders, diseases. So we have to fight back even more so than our male counterparts. We have to be on top of our health. Okay, it's really important what we do to take care of ourselves and our health in our teenage years, 20s, and 30s. It's going to dictate what our 40s, 50s, 60s, 70s are going to be like. Okay, it starts now. So rheumatoid arthritis is one of several different types of arthritis. As you all know, many, many different types of arthritis. If you are not a stranger to this channel, you know that you've heard me talk about that many times. So rheumatoid arthritis and osteoarthritis are the ones that you hear about a lot, but there's also juvenile JRA, juvenile rheumatoid arthritis. So even though there's that age bracket of 30 to 60 or older when it would show up, you have kids that get rheumatoid arthritis. Okay, so I think this is a discussion that really can affect almost all age brackets, and this information is going to be important for us to know, right? So you've got also lupus. A lot of people were surprised to find out that lupus is really like a form of arthritis. And in that same kind of vein or token, just like lupus is an autoimmune disease, rheumatoid arthritis is as well. So what it does is, when it's autoimmune, it's a disease where the body is attacking itself. In this case, the body is attacking the lining of the joints, okay? And that, of course, causes some problems as that starts to break down. So we need that lining, of course, to help and produce the fluid that lubricates the joints when we move, okay? So it's really important. So rheumatoid arthritis is chronic, okay, which means it keeps coming back. It's not like something that is, oh, okay, you feel that for a week or two and then that's it. No, it's something that keeps coming back. And it's known for having cycles that people will call flare-ups, right? And it's also an inflammatory disorder. Okay, so we know that we also talk about inflammation a whole lot on this channel or outlet. So this is again another very good discussion, a very appropriate discussion. Okay, because inflammation is really something that we can relate to being the cause of a lot of other conditions, because chronic inflammation is an issue that can cause other issues. Okay, it's linked to diabetes, it's linked to cancer, and I'll talk to you specifically in a few minutes about what rheumatoid arthritis is linked to. So, rheumatoid arthritis is systemic. It affects not only the joints, but in addition to the joints, the skin, the lungs, the heart, okay, the eyes, the blood vessels, and then, of course, your muscles, your cartilage, your ligaments, the things that are surrounding the joint as well. Rheumatoid arthritis increases the risk of heart attack as well as stroke. So that's what it's linked to or related to. So it's increases the likelihood of a person having issues with their heart because of the pericardium, the a part of the heart that actually is attacked by the body. So again, autoimmune, just like the lining of the joints are attacked by rheumatoid arthritis, there's a part of the heart that can be attacked by the disease as well. And then, of course, because the blood vessels are a part of what can be affected with rheumatoid arthritis, this is also why then you could be more susceptible to having stroke, okay, because that involves the blood vessels leading to the brain. Rheumatoid arthritis, as we spoke about, it is an autoimmune disease. So it's the body basically attacking itself, the body attacking the body, instead of just attacking foreign substances like bacteria or viruses, which is what it's supposed to do. Okay, so what are some of the symptoms? Initially, some of the symptoms would be things like the small joints of the fingers and or the toes. They may be warm, stiff, swollen, and then there are flare-ups that last just a few days or weeks. Anybody else getting this nice rain where they are? Getting some rain and thunder over here. I got some big plans after this broadcast. Hello to those of you that are popping in on Instagram. Our topic this evening is how to improve rheumatoid arthritis symptoms. So we've just talked about a little bit of background information on rheumatoid arthritis, and now we're talking about some of the symptoms. So now I'm going to tell you a little bit about the long-term or the later symptoms. This is where now it moves from just affecting the smaller joints of the fingers, the hands, and slash or the toes. No problem. Someone says they're late. You're never late. You're here. All right. And let's see. The flare ups in the later stages tend to also last longer. And then there's a shorter rest, break, or remission period in the middle. So it starts to become like, I would say this is where it starts to become more of a debilitating issue, because it's not now like every now and again you feel your fingers are a little bit stiff or your toes are a little stiff. Now it's becoming, okay, now it's my fingers, it's my toes, it's my hips, it's my shoulders, and it's my elbows. And now I'm feeling this for weeks on end and I get only a little break. Y'all, ooh, my current just dipped. So if I have a break in transmission, y'all, that's why. All right, but let's see if we can get through this. I won't keep you long tonight. We've got some nice rainy weather on the outdoors there. So some of the other symptoms can include things like fatigue, low-grade fever, loss of appetite, which could also then in turn lead to weight loss, but not a healthy weight loss, unfortunately. Anemia, which will be due to reduced iron absorption during flare-ups, which then, of course, goes back to the fatigue. Okay. Rheumatoid nodules or lumps under the skin in the hands, particularly in the hands, this is common, but it can also occur in the elbows or the ankles. Now, there are 4 stages of rheumatoid arthritis. Stage 1 is basically the mild stage, stage 2, moderate, stage 3, severe, and stage 4 is end stage. By the time a person gets to about end stage, there's very little that treatment can do for them. There isn't, of course, a cure, but there's just treatment and management of this disorder. So let's talk about some of these recommended treatments. So, of course, you have medication. They have a whole gamut. NSAIDs is one, but there are several others as well. Steroids are another way to treat as well. And let's see, also lifestyle changes. Y'all know that's one of my favorite things. But medication can be combined with lifestyle changes to get the best result for the patient or client. Let's dig into lifestyle changes, right? So, lifestyle changes could be things like balancing activity and rest. We know there's this issue of fatigue, anemia being another possibility for a symptom. So, it's not that you want to burn yourself out, right? Or just completely tire yourself out. You want to balance it. You also don't want to go all the way to the other end of the spectrum and just be a complete like couch potato, right? So it's a balance. Everything is a balance. So balancing the appropriate types of activity and getting some rest as well. And I always tell persons to just listen to their bodies. That's really, really important. Your body will let you know when you are doing too much. Okay. And then you just listen to that. And when it's time to take a break, you do so. All right. Recommended activities. Things like strength training, aerobic exercise, aquatic therapy, and Tai Chi. Okay. I always think that Tai Chi is so interesting and so versatile. It's so peaceful, but I can also recall writing a paper before about Tai Chi being very effective in the treatment of Parkinson's disease. So Tai Chi, I would say, is very versatile as a practice and a treatment. It helps persons with balance also. I'm kind of feeling the whole Tai Chi vibe as like a holistic therapy method. Okay. It's some pretty useful stuff. All right. So some of the dietary changes that a person could make if they have rheumatoid arthritis or if they may be susceptible to getting rheumatoid arthritis or if they just want to get a little bit healthier. Okay. Reducing sugar. They could eliminate gluten from their diet. Also, they can increase the omega-3 that they are taking in. So that would be by eating things like more sardines, mackerel, salmon, snapper. Okay. Hi, so contagious. Nice to have you on. Okay, so something like let's see, omega-3 rich foods. They're good for the heart. They reduce inflammation. Okay, that's a big one. And also, they may help in reduce joint pain and stiffness, okay, that are resulting from rheumatoid arthritis. And it's recommended to eat at least 2 portions of that type of fish in a week. Okay. So make sure that you're adding a lot of, I think this is a good practice for most of us. We talk a lot about what are some easy changes that we can make to our diets and, putting in some more of this kind of like healthy fat and like fish oil, omega-3, okay, naturally into our diet. And natural is really what I would say is best. Supplementation is like the next best, but I really like the idea of getting it from your food directly. It's like what is it, like the paleo diet, right? Which was one of our other topics. If you missed it, be sure to just go back through the Facebook videos in particular and find it. Okay, so make sure that you like and follow on Facebook so that you don't miss any of these topics. All right. So, also for dietary changes, you could think along the lines of the Mediterranean diet. That's another topic that we have covered here on our social media outlets, right? So, the Mediterranean diet, again, stays based on, like just really like lean meats, mostly fish, olive oils, healthy oils, lots of nuts. And if you are interested in getting a 30-day Mediterranean meal plan, then if you're on Instagram, go ahead and just click on the link in the bio and go ahead and scroll down to the 30-day meal plan section, and you'll be able to purchase the 30-day meal plan there. And let's see, that is going to be the easiest way to get to it. Your omega-3, the best place to get your omega-3 is from those fish. Okay, but you're also going to get some healthy, the nuts are healthy as well and good for you. They're a good source of like your protein and things like that. They're a good substitute for persons that, for instance, are not having a lot of like protein from animals. Nuts are a really, really good substitute. They're a really good source of energy. So if you're a person that likes nuts, then that's really already like a plus for you, that you can add some into your diet. And I would say stray away from the ones that have a lot of like the salt on them. If you must do the salt, then it's kind of like do something that's like lightly salted, or just a lightly sweetened. Some may come with like a drizzle of honey and things like that. um or like if it's like a nut cluster kind of situation, because I've definitely seen those as snacks. Okay, but always just kind of like, and be monitoring, because you don't want to overdo it either, because they do have calories. So if you, especially if you're trying to watch your calorie intake, then you want to be sure that you're not overdoing it on something like the nuts. Okay, but the nuts are really healthy. They're healthy, and they're a very good source of protein for you. Okay, so I would still encourage you to put some nuts into the diet. Okay, and there are many different ways to do that. So you could either have them as a snack, or if you're into doing that a little bit of extra work, you can have them also as, don't forget, nut butters. You could either purchase nut butters, or you could make your own, like almond butter, for instance. If you had like your raw almonds, you could make your own almond butter. Let's see, you could also make your own almond milk, which is another way to get in some of that good protein, right? So you're most welcome. All right, so let's see. Oh, and just another little note on the Mediterranean diet. Research does show that there's improvement in people that follow the Mediterranean diet with their rheumatoid arthritis symptoms. Also, another pointer here, eat more iron-rich foods. So those are things like your leafy green vegetables, eggs, peas, beans, lentils. Okay, so many different ways to really work those in. I can think of quite a few good ideas: soups, stews. Your leafy greens would be nice on salad. So there's tons that you could do. Tons that you could do with those different foods and food groups. Okay. Also, eat calcium-rich foods. We know that calcium is, of course, good for bones and joints. With rheumatoid arthritis, it's no different. We should all be getting in some calcium into our diets. Okay, and calcium-rich foods. Again, we have nuts on this list. You've got almonds on here, sardines, yogurt, low-fat milk, calcium-fortified soy milk, and orange juice. So you will see that there are going to be certain things that are going to have calcium added also. Particularly, there are some beverages that would have it added. So if you're someone that perhaps does not eat a lot of dairy, or maybe doesn't eat dairy at all, then you would have still those alternatives. They would still have, because of the almonds, almond milk would naturally have some calcium. Okay, so there's still a way to get in all the nutrients that you need. So, stress management, relaxation. It's important for pretty much everyone, okay? For persons that have rheumatoid arthritis, they would definitely, it can be stressful dealing with a chronic condition, okay? Just even knowing that, hey, this is not going away. I have to deal with this for the rest of my life. That in and of itself can be a source of stress. And then knowing that it can progress through the stages. Now, progression can be slowed with the appropriate treatment, right? Like the things that we're talking about tonight. So if anybody is experiencing any symptoms that sound similar to this, I would highly encourage you to book an appointment with your primary care physician, get the necessary physical examination, as well as any tests that may need to be run to try and rule in or out this condition, right? Because it's something that you want to catch in its early stages, start to get some treatment, and really create a plan, a wellness plan to move forward with this condition in a way that would be the least disruptive to life. Because where the stress can come in also is just knowing that and not being able to do all of the tasks that a person used to. Some persons can even have a hard time getting out of bed. They can have a hard time doing tasks like getting dressed. Okay, so that would provide, definitely, it could be a source of stress for some persons. Okay, so let's talk about what are some ways to help and manage that. Guided meditation. Meditation, as simple as it really is, I won't even say as simple as it sounds, can be difficult to know like where to start. So either reading books on meditation can be good, and or just listening to guided meditations. I always am a strong proponent of the Calm app. They have tons of guided meditations in there, and there's even a 30-day series that literally teaches you how to meditate. So they go over like the different little components, and then they give you a few minutes to practice the meditation. And they're just a few minutes. It's not like you have to meditate for an hour or anything. Even if you can do 10 minutes, it really makes a big difference. So that's the guided meditation. Also, mindfulness. Okay, so that's kind of, that's like a buzzword or term these days. Mindfulness is really just taking that step back and really being present in the moment. Maybe sometimes stepping back and thinking about how you feel how you feel about yourself and your condition that day, how you feel about some of the different events of the day, things that are happening around you. And sometimes I would say even just taking a moment to even evaluate what your response is to what's going on around you and in your life. I have a question here. Do they have affirmations as well? I have not seen affirmations in there, but let me know if affirmations are something that you're interested in. Let me know if you would like me to incorporate that perhaps into something that's upcoming that we would be doing. Because let me know if do people have their trouble writing their own affirmations? Is that why you're asking? Or are you having trouble finding affirmations? Are you looking for something that's just okay? All right, so we have a yes there. Okay, so all right, that's very good to know. So that's something that you could possibly see from me coming up. Okay, I have not seen it in the Calm app. Unfortunately, they don't have that in there at this time. But I've got something coming down the pipeline. All right, so breathing exercises are another good one. Don't ever sleep on the positive effects that deep breathing could have. It's something that's helpful for even pain control. And it's helpful, I believe, also in helping to like regulate your responses, your emotions. Sometimes you need to take a good deep breath before you decide to make a response, right? Take a deep breath and sometimes count to 10 before responding. Biofeedback is another one. Okay, so biofeedback, if you're not familiar, basically it's usually using a machine that will give a tone when your muscles are basically firing, so that you would really have like that auditory response to know, hey, like my muscles are not relaxed, my body is not relaxed, and then to learn how it feels to control those muscles. And then, of course, journaling is another great one. Okay, so I would highly encourage everyone to take the time, even if it's just 10 minutes, and even if you can't do it every day, try to perhaps journal for 10 minutes when you have the time. Every day if you can. If you can't, then do it when you can, even if it's only 2 or 3 days out of the week. And you'll want to go ahead and do that, even if, and it may be kind of like the affirmations, it may help you to have prompts because it may be a little bit difficult if it's something that you're new to doing to journal for an entire 10 minutes. And literally, you can set a timer on your phone and, kind of just go for 10 minutes. And it's for you. Always remember that it's for you. So there is no right or wrong. Okay. You can write about whatever you want to write about. If it's not all rainbows and sunshine, that's okay. It's just for you. You don't have to put on for anybody, as we say here. No putting on. Just go ahead, and it helps so much just to get your thoughts out, even if you feel like you wouldn't be comfortable expressing it to another person. But at least you were able to get it out of here and out of here, right? So those would be my suggestions to you, okay, for different things to do. And I think that all of those are good for all of us, not just people that have rheumatoid arthritis. Now, if you find that you do need a little bit more assistance just getting your health and wellness on the right track, then of course, do feel free to reach out to me. You can book a wellness makeover assessment. I would go ahead and give you the information for that. Just go ahead and DM me. You could DM me the word call, okay? And I will respond to you and let you know how you can book a wellness makeover assessment with me if you want to find out more about how health coaching could help you out and how it could be appropriate for you. So that is my 5 cents for the evening. Okay. Be sure to like, share, and follow. Y'all, there are so many changes that are going to be coming up on all of these channels. So definitely like, share, follow, subscribe. You don't want to miss any of this. Okay. The last year was just the warm up. So I have lots more on tap for you all. As always, I will keep the lines of communication open. I want to hear about more of what you want, okay, so that I can bring to you the topics that you want and the services that you need, the products that you need, okay? All right, most definitely. You're welcome, so contagious. So I hope that everybody was able to get at least one thing from the presentation this evening. If there are no further questions, I'll give it another couple of seconds for any questions that might be on either of our, well, actually any of our outlets, because we are on Instagram, Facebook, and YouTube this evening. Okay. So I'm just giving it another couple of seconds to see if anybody has any additional questions. If not, I am going to get ready to sign off. Okay, so it's Dr. Felicia here, making the world healthier, one woman at a time. See you all next week, Thursday, 7 p.m. Eastern, for another topic to help you improve your health and your life. Bye.